Hey, thanks again for joining me this week. First of all, it's good to be back. I've been battling a relentless cough and bronchitis, and I haven't wanted to make you listen to me coughing while I was trying to talk. In fact, mostly what you would have heard is coughing. But now I can talk without coughing pretty much, and I'm glad to be back. I want to thank everyone who helped cover during that time, especially Rich for the work he did. We had a great event this week with the major announcements that is important to economic development, scientific research, and Montgomery County. This week, WMATA announced that Hines will be the master developer for the 14-acre site adjacent to the North Bethesda Metro Station. It will include housing, retail, office, and lab spaces. In fact, 3 buildings are life sciences buildings, and the permanent home of the University of Maryland Institute of Health Computing, or UMIHC, is going to be there as well. This firm has been operating in our region for more than 40 years, owns and operates over $90 billion of assets across property types. I want to take a moment to explain why this is such an exciting development. When I was on the county council, this is about 6 years ago, there was a lot of talk about the need to increase economic development and job growth in the county, but not much action and not much of a plan on how to do it in a way that uses our strengths and puts us on a path to growing good jobs. Soon after I became county executive more than 6 years ago, and after initially working to jumpstart the White Flint development by finding a developer partner who was willing to work with the current owners on a project, only to not have it pan out, I then started to explore what else I could do with the development potential that had been created to accommodate Amazon. And after a lot of discussions with people around the life sciences industry in the county and seeing how research had changed during COVID and how it was being done, I went to the University of Maryland and asked them to bring a graduate level research program here focused on marrying AI capabilities to biological research, drug development, and patient information. I pointed out the incredible resources we have in the life sciences industry here. Together we could create a center using the university's expertise in AI and medical research to drive drug discovery and advanced research and technology here in the county. I also talked about how we could develop the metro site all the way down to the old mall in a way that creates what people call collision spaces, a social environment where scientists meet, gather, and share their ideas and advance their work, and where they can interact with others in the life sciences industry. I recognized that White Flint metro area represented the largest underdeveloped parcels next to a metro station in the county, with a potential for 15 million square feet of new development, and it's close to NIH, NIST, and other critical life sciences access. So I approached WMATA about the North Bethesda site and asked them to partner with the county on a joint development agreement. Well, the university system launched the IHC. We created the development agreement with WMATA, and all this came together at the press conference this week. Our region is currently the 3rd largest bio-life science business cluster in the nation, but we were the only cluster without a graduate level research institution. This partnership with the University of Maryland College Park, University of Maryland Baltimore, and the University of Maryland Medical System is a game changer for both our county and state's economy. What makes this project stand out and what turns heads when I travel and talk about it is the UMIHC. I've talked about this partnership at National Bio, most recently at ICSC in Las Vegas. I've talked about it overseas when I've met with business leaders and investors. When they hear that we're bringing together AI, clinical data, and life-saving research in a metro-accessible location between NIH, Shady Grove Life Sciences, they want to know more. All of this is the center of a huge pool of talent. People want to be part of it. UMIHC is already up and running with more than 100 people working in a nearby temporary space. They're not just talking about innovation, they're delivering it. And the commitment from the University System of Maryland to make this their anchor location has been critical in getting to this point. North Bethesda is going to become the epicenter of our region's life science community. This development at the North Bethesda Metro Station will also be a catalyst for more development in the area, as the currently vacant former White Flint Mall is nearby, and it will support life science research in our existing Shady Grove Life Sciences Center. This announcement also comes on the heels of a strong month for economic development in the county. We recently announced the county's first ever tax increment financing package to support the Viva White Oak project, a project with enormous potential for the East County that has been stalled for a decade. Through our new MOVE grants, we helped PowerSolve relocate their headquarters to Rockville and Bernstein Management to move theirs to Bethesda. These wins show that our efforts are working, and that's because we're building strong coalitions between local government, the private sector, our state partners, and our congressional delegation. I'm especially appreciative of Governor Moore's leadership and the support of the Montgomery County State Delegation. By working together, we can create jobs, drive innovation, and invest in the kind of industries, bio, life sciences, AI, and tech, that are helping to shape the future. There's more to do, but this is a big step forward. After the WMATA announcement on Tuesday, I joined Governor Moore at Montgomery College, along with Secretary of Higher Education, Dr. Sanjay Rai, State Superintendent of Education, Dr. Carrie Wright, MCPS Superintendent, Dr. Thomas Taylor, and other college leaders from across the state. At this roundtable discussion, the governor unveiled his Fed to Ed initiative. Governor Moore announced $1 million in state grants to help launch this program, including $100,000 from Montgomery College to support outreach, advertising, and developing this work for Montgomery County residents. The goal is pretty straightforward and smart. Take people who've been displaced by recent federal job cuts, including employees, contractors, NGO staff, and vendors, and help them become teachers. We have a clear need. Like most jurisdictions, Montgomery County is facing a teacher shortage, and the governor made a compelling case that we need to move faster to get qualified people into our classrooms. And I agree. During a roundtable discussion featuring state education leaders, the governor asked what I think was the most important question of the day: how do we go faster? And that's the right question, because the need is real for our students, our schools, and for the talented people in our region who want to continue making a difference. As someone who changed careers to become a teacher, I know firsthand how fulfilling that path can be. I also know that people coming from federal agencies, nonprofits, and technical fields have a lot to offer. They understand systems, communication, and real-world problem solving. These skills can absolutely enrich the learning experience for our students. I want to thank Governor Moore for his leadership and our partners at Montgomery College and MCPS for helping turn this idea into a program. We look forward to supporting Fed to Ed and promoting it in upcoming media briefings to help spread the word and bring more great people into education. You can visit teach.maryland.gov to learn more about the pathways to teaching. This week, the Trump administration released a list of so-called sanctuary jurisdictions, and Montgomery County was included. Let me be clear, we are not in violation of federal law. We are not going to make changes based on political headlines. We've always cooperated with ICE in cases involving violent criminals, serious felonies, and public safety threats, and ICE knows that damn well. That has always been our policy. Our Executive Order 135-19, which guides our actions, has been legally reviewed and upheld by two Maryland Attorney Generals, Brian Frosch and Anthony Brown, and we've followed it consistently. Now that we're officially on this list, we'll be carefully reviewing what the federal government has put out, specifically reviewing their explanation of the criteria to make this list, what they're demanding jurisdictions to do, and what the consequences would be if we don't do it. We'll do that work in consultation with our public safety team, our county attorney's office, the county council, and our partners at the state level, including the attorney general and the governor's office. And we'll coordinate with other jurisdictions in Maryland and the region that have also been threatened. What I want you to know is this: our job is to keep everyone safe, regardless of immigration status. We don't ask about status when you call 911. We don't ask when an ambulance arrives. We don't ask when your child goes to school. We're not going to let political rhetoric change how we treat people in Montgomery County. And I'm going to be blunt. This action, like many others of the Trump administration, is about criminalizing immigrants, not protecting public safety. If they were, they'd be focusing on the people who said they wanted to remove all these horrible gang members and everything, rather than picking up people who haven't done anything other than just be here. And we will not be complicit in efforts to stigmatize or target our immigrant communities. Businesses in this county, this region, and throughout the country will be shuttered if a large part of the labor force is removed. For people or businesses who thought they were only going to go after the bad guys, you were wrong. This is about everyone, not just violent criminals. And if carried out, it will have profoundly negative effects on the economies. And if you're a business person, you can calculate for yourself what it's going to mean if all the immigrant workers in your businesses disappear. Immigrants are essential to our workforce, and they contribute to the community culture and vibrancy. In 1960, when I was a child growing up in Montgomery County, immigrants made up about 5% of the total population. Today, foreign-born residents make up over a third of our population. I understand that members of our immigrant communities are worried. These kind of announcements are designed to create fear. And we've seen this before in our country and around the world. We do not govern by fear in the county. All these actions by the Trump administration to divide our community and demonize our friends, neighbors, and co-workers are morally bankrupt and economically reckless. And to try to wrap their hate campaign in a veneer of Christianity is deeply disturbing. One of the major hallmarks of all major religions are concepts of mercy, of obligations to help the poor, heal the sick, and house the unsheltered. You may be shocked to know, and I hope you are, that county programs that provide shelter for the homeless, or food assistance, or medical assistance constitute the crime of harboring illegal immigrants. It's a crime. The county does this, our nonprofits do this, and many of our religious institutions do this. We do what decent, compassionate human beings do because it is the right thing for us to do. Criminalizing decency and compassion is a travesty. It needs to stop. And for anyone in our community who needs immigrant-related information, I encourage them to visit the Gilchrist Immigrant Resource Center at montgomerycountymd.gov/Gilchrist, or visit them at their Wheaton, East County, or Gaithersburg locations. Montgomery County will stand by all of our residents, including our immigrant residents, as we always have. We'll continue to follow the law, but we will not join efforts to divide our communities or erase the contributions of our immigrant neighbors. I want to acknowledge my deep disappointment, but not surprise, with this week's announcement that the CDC will no longer recommend the COVID vaccine for healthy children and pregnant women. It's an odd use of words because you wouldn't have COVID and be healthy at the same time. This decision is not based on science. It's not based on the best way to guide millions of Americans who rely on the Center for Health advice to avoid disease. And that's not just wrong, it's dangerous. And it's insulting to the scientists who worked tirelessly to save lives during the pandemic. During COVID, Montgomery County had one of the highest vaccination rates in the country. And as a result, we had one of the lowest death rates in the country among large jurisdictions. This is not a coincidence. This is called cause and effect. The state of Maryland numbers would not have been so good were it not for the benefits that 1/6 of the population that lived in Montgomery County provided to those numbers. The vaccine saved lives, period. This new guidance upends the way good policy is made based on science. It's another sign that we're living what Gore Vidal once called the United States of amnesia. We're talking about something that happened just 4 or 5 years ago, not ancient history. How can the most scientifically advanced health agency in the world now ignore the very science that helped us get us through this? It's chilling and it's infuriating, and honestly, it's a sign of the times to come. We're going to keep doing what we've always done, following evidence, protect our residents, and speak the truth, no matter how politically inconvenient it may be. On Thursday, we held a ribbon cutting to officially launch Montgomery County's mobile health clinic. The ceremony took place in Poolsville, one of the areas that has been waiting for this kind of help. Since 2023, we've had a mobile health clinic in place in a roundabout kind of way. It was basically on call, only able to serve the community on a very limited basis. Now we have an actual vehicle that will serve as headquarters for our mobile health clinic. We are focused on delivering community-based care. That means serving a range of critical health services beyond just medical and dental. This clinic will offer behavioral health and preventative screenings. It will also be a resource for social services information and connections to follow-up care and health education. We intend this clinic to spend most of its time in underserved neighborhoods throughout our county, helping our most vulnerable residents. You can contact the program leaders by sending an email to mobilehealthclinic@montgomerycountymd.gov. This clinic proves we're thinking ahead when it comes to improving conditions for everyone in Montgomery County. I'm excited to see how this mobile health clinic will strengthen communities across the county. Together, we're making Montgomery County a more equitable, healthier place for all. This week marks 5 years since the murder of George Floyd, an event that shook the conscience of this nation and sparked a movement for justice that still resonates. It was a defining moment. It was one of the events in 2020, along with the COVID pandemic, that impacted how this government operates and how we think about our responsibilities to the people we serve. The murder of George Floyd was an awakening around the nation, but I want to point out that we were already on the path of addressing racial equity and social justice in our government even before this tragic event. Months earlier, on December 3rd, 2019, I signed the Racial Equity and Social Justice Act, became the first Maryland jurisdiction to sign a racial justice and equity legislation which ensures all residents are welcome, treated with respect, and have opportunities to succeed. From this legislation, we created the Office of Racial Equity and Social Justice. Since then, Montgomery County has made real, measurable progress. Internally, every department of the county now is required to submit a racial equity impact score on their budgets. This means they're looking at who's impacted, who benefits from the investments we're making. There was a time in this county when certain communities did not get investments, other communities got lots of investments. We're trying to be more equitable about this. And every county employee goes through regular racial equity and social justice training to help ensure our values are reflected in how we serve the community. We've also made progress externally. We launched a hate crimes data portal to track and respond to rising incidents in the county. We created a police accountability board to increase transparency and trust. And we've continued our work on reconciliation and remembrance, including the historical markers for county lynching victims and increasing our support toward many historical Black communities in the county, such as Scotland AME community. I want to acknowledge and appreciate the leadership of Chief Jones, as well as Chief Marc, as well as the command staff and the officers of MCPD who've embraced the new training, policies, and technologies to improve public safety and community relationships. Crime continues to decline, and so has the distance between our residents and those who protect them. The year 2020 will be remembered for the devastation of COVID and for the outrage and clarity that followed George Floyd's death. That year validated our approach to act more boldly and with greater intentionality. We're now living in a time where there's a deliberate effort to erase those memories, where a federal administration is punishing taxpayers and holding programs hostage because they don't like the progress we've made. It's surreal. This is a government where the president actually says that if you see a woman or a person of color in a position of importance, that they're only there because of DEI policies. That could not be further from the truth. It hasn't ever been true, and it's really disturbing to have this lie spread by the federal government. It is surreal, it is outrageous, but we're not going backward, and we know what's at stake, and we're going to keep doing the work. That's it for now. I hope you have a great weekend. I'll be back again next week, and hopefully my voice will be a little bit better.